I would like to welcome everybody out to our groundbreaking for the South Providence Medical Building. I am Mitch Wasden. I'm the Chief Executive Officer and Chief Operating Officer of MU Healthcare. This is a fantastic turnout. We thank you for coming out here and braving the sun. We actually even still have a few chairs up here if you would like to come up here. Today we're going to have a few speakers chat with you about our vision for the South Providence Medical Building, and many of these individuals have actually been very involved in the planning. One individual who is not going to be a speaker, but who is here and we'd like to recognize is Mr. David Mountjoy, who is our Executive Director for our clinics. You can stand up, David. He's looking very stylish there after finishing an Alcatraz triathlon, if I remember, and he made it past the Sharks. So would like to thank David for his many years of work in getting this building planned and designed. This building is a $35 million project and 85,000 square feet, so it is a very big project, and it represents the future of what we would like to do with more of our MU healthcare facilities. And I think over the next 5 to 7 years, you'll see more facilities like this as we try and upgrade our brand and upgrade our services to our patients. Our speakers that we'll be honored to hear from today include President Tim Wolf, Vice Chancellor Dr. Hal Williamson, Dr. John Lauriello, Chair of the Department of Psychiatry and Medical Director for the Missouri Psychiatric Center. Representing the Department of Family and Community Medicine are Dr. Steve Zweig, the Department Chair, and Dr. Mike Lefevre, the Department's Vice Chair and Director of Clinical Services. At this moment, I would like to turn the time over to University President Tim Wolf.
Good morning. Thank you, Mitch. I'm pleased to be here today as we celebrate this groundbreaking. This new clinic we're building is a strong example of the University of Missouri's commitment to the state of Missouri. At the University of Missouri, our core mission is to advance our state by providing education to our citizens and to support the vitality of Missouri's economy. This facility will help us towards achieving those goals. The South Providence Clinic will help us train a new generation of healthcare professionals with the latest medical techniques, such as our family and community medicine department's innovative work in medical home models of primary care designed to improve patient health outcomes. Our students also will have the advantage of learning with the help of tomorrow's high-tech tools, such as MU's healthcare state-of-the-art electronic medical record. This was developed with the University of Missouri strong partnership with Cerner, a Kansas City company, and it's called the Tiger Institute for Health Innovation. And as healthcare needs of our state grow, this clinic will provide additional space for physicians, nurses, and other healthcare professionals to provide world-class healthcare to more patients. Their efforts will help ensure Missouri has a healthy, productive workforce for the future. Now I'd like to turn the microphone over to MU Health System Vice Chancellor, Dr. Hal Williamson, so he and other speakers can tell you more about this great clinic. Thank you.
Thanks a lot. Before I start, I want to introduce a person that we didn't expect to, a dignitary that we didn't expect to be able to join us today. So Dr. Les Hall, who's the interim dean in the School of Medicine, would you stand up, Les? So round of applause for Les. As President Wolf indicated, today is an important day for the University of Missouri Healthcare. It's also a special day for me personally. This facility we are building is a replacement for our university physician Green Meadows Clinic down the road there, where I've cared for patients with many of my colleagues for over 20 years. During the past 2 decades, our Green Meadows footprint has grown to include several buildings totaling about 50,000 square feet. But as the demand for healthcare in our community has increased, our interest in teaching students and nurses has increased, we have outgrown the Green Meadows campus and now we need to expand. At 2 stories and more than 85,000 square feet, our new South Providence Clinic will be nearly twice the size of our current Green Meadows. We'll also be able to consolidate the same services spread across several buildings now under one roof. an improvement we wanted to make for our patients and our employees. With so much more space, this clinic will house family and community medicine, general pediatrics, behavioral health, as well as a larger pharmacy, a drive-thru pharmacy, I think, imaging and laboratory services, and that'll be right here where that fellow's mowing the grass over there behind me. As a rule, most people don't really look forward to moving or change, but this is an exception. I think I speak for everyone at Green Meadows when I say we are really looking forward to moving with great anticipation. I'd now like to introduce to you Dr. John Lauriello. John is the chair of MU School of Medicine's Department of Psychiatry. He's the Chancellor's Chair of Excellence in Psychiatry and the Medical Director of the Missouri Psychiatric Center. John.
All right, thank you, Dr. Williamson. I'm really happy to join all of you today and celebrate this event. When I came to the University of Missouri in 2009, my goal and the goal of MU Healthcare was to expand behavioral health services in central Missouri. Since 2009, we've opened the University of Missouri Psychiatric Center and renovated 3 inpatient units and expanding the center's capacity to 62 beds. This groundbreaking marks another milestone as we work to expand outpatient mental health services. As many of you know, mental health conditions are incredibly common, affecting up to 1 in 4 American adults. Luckily, most patients can manage their diseases with the help of medication and outpatient therapy. When this South Providence clinic opens in spring 2050, we will expand greatly our outpatient psychiatry clinic to 17 treatment offices, and we'll be able to care for more of our Missourians. As you know, the mission of University of Missouri Healthcare is to enhance the health of all Missourians. This new facility is going to help us move forward in that mission, especially in regard to providing the outpatient mental health services needed in our community. Next, I'd like to introduce my colleague, Dr. Stephen Zweig, Chair of MU School of Medicine's Curtis W. and Ann H. Long Department of Family and Community Medicine, and the Paul Revere Family Endowed Professor of Family Medicine.
Thank you all for coming, and thanks, Dr. Lauriello. I also agree that today's event really reflects a tremendous commitment of University of Missouri Healthcare to this community in meeting the needs of our community. And as a family physician, I truly believe that primary care is the cornerstone of healthcare for our nation, and I'm glad that we're going to have the opportunity here to work to continue to develop a patient-centered medical home in collaboration with our colleagues from child health and psychiatry, as mental health is really an important part of this foundation primary care service. Between family medicine and pediatrics, we'll have 80 examination rooms in this clinic, but we've also designed it in such a way to help to address the future needs. And we've had a lot of attention to trying to be convenient for patients and consolidating services in one area. So for example, one can come to the physician, receive laboratory tests, imaging studies. We can send your prescription to the pharmacy electronically, and the patient can pick it up on the way out the door. So now I'd like to introduce Dr. Michael Lefevre, who is the Vice Chair and Director of Clinical Services for our department and the Future of Family Medicine Professor. Mike and I were among the faculty who came to the first Green Meadows Clinic in 1984, the first university practice that was off-site from the hospital's footprint. And we're honored to help lead this new site into the future. Thank you.
Thank you, Dr. Zweig. One of the strengths of MU's Department of Family and Community Medicine is that we're always trying to look for innovative ways to improve health care. It's unfortunately true that I can look around the audience and be pretty sure that all of you either have been or will be patients at some moment in your life, and we've tried to design this clinic around you to improve your experience. When we began designing the clinic, we wanted to build it not only for healthcare today, but for healthcare in 5, 10, 15 years from now. To do that, we've designed the clinic for greater collaboration among health professionals Our new facility will make it easier for primary care physicians, nurses, dietitians, and other healthcare professionals to collaborate, to work together to keep their patients healthy and to treat their medical conditions. We've also designed this clinic with a high-tech, high-touch philosophy, taking full advantage of MU Healthcare's advanced electronic medical record so we can spend more time with patients and less time flipping through patient charts and not finding things. In designing this facility, our priority focus was family and patient-centered care, which is at the center of all we do at University of Missouri Health. Next, I'd like to introduce my friend and colleague, Dr. Tom Selva, who is the Chief Medical Information Officer for MU Healthcare and the Division Director and Professor in MU's School of Medicine, Department of Child Health. Tom.
Well, good morning, everybody. This certainly is an auspicious day, and it's a tough act to follow with everyone that's gone before me, so I won't be long because I know we're eager to get started. You know, that's often said that change isn't always good. Well, this is good change for a good reason. Columbia and the surrounding communities have grown, and their needs have grown, and we're answering that need with this new facility. As Mike said, we built this facility to keep the family, the child, the parent, the patient at the center of the care. That's not often been the case in our previous old facilities, as many of you have known, being patients in those facilities. So how did we do that? Well, I would like to say this is probably the first time in an outpatient facility where patients helped us design this facility. On the pediatric side, we had mothers with lots of small children come in and say, does this really make sense to you? And you'd be surprised at the suggestions they had, down to the size of the toilets in the bathroom, because they don't really meet the needs of children, they meet the needs of adults. So the whole building, the whole pediatric facility was designed around the needs of the parent and the needs of the child. We also included residents in the design of this facility. As President Wolf has mentioned, our core mission is education. And so it's important that the residents have something to say about whether this facility meets their needs and our efforts to educate them as they move forward as primary care providers in this state. Finally, with technology, we've made a concerted effort to make technology transparent to the patient, but critical to the needs of the physician and those providing care, so that the patient and the physician can truly collaborate in their care as they move through this facility. So it's been a wonderful journey, one that I've had a wonderful time going along with, and I look forward to this building opening. I know we're eager to get started. I can say that for everyone here, so I'm going to turn things back over to Mr. Wasden to take us forward. Mitch?
Okay, well, we would like to thank all of our speakers today. We'd also like to give people just a sense from everybody's comments that, you know, healthcare is changing. And one of the things that we try to accomplish, or one of our goals when we do a new facility like this, is to look out into the future and see where healthcare is going, and then try to create a facility that shapes the future and meets people's needs for many, many years to come. It's interesting that this facility alone will do will see over 100,000 patient visits annually. So that's about one visit per person in the city of Columbia. So it will do an enormous volume of visits. Without delay, why don't we move to the groundbreaking ceremony? So I'd like to invite all of our speakers to come up. Following the groundbreaking, we invite everybody who is here to join us for refreshments and for a little conversation afterwards. Thank you.
Yeah, pull them out, and then how about 1, 2, 3, dig.
All right, so one, get a big double. 1, 2, 3.
Dig.
Goes for double.